You can't replace part of the brain. Like, you
treat them the same.
The source of truth for the medtech industry.
Coexists with the prophets.
Robot understands things automatically.
Number one show in the medtech industry.
So Stryker got ahead of that and changed in the 90s, built $1 billion company that held up high, a lot of things.
State of MedTech with your host, Omar and Khateeb.
Everybody, welcome back to the show. I'm delighted to have our guest joining today because many of you don't know him, but you do know of him because if you've heard me reference any statistics and data from this great report, which you can find in the show notes below, I left the link for it, called the HSBC Innovation Banking Venture Healthcare Report. That was put together by Jonathan Norris and his team. Jonathan Norris joins us today. He's the managing director over at HSB Innovation Banking. Great report. Jonathan, thank you so much for joining us today. How are you doing?
I'm doing good. Yeah, thanks. I appreciate the invite.
Absolutely. Now, one thing I'm going to recommend to my audience, because we have a large group of people who listen to this podcast. Of course, the investors and family office and venture capitalists are going to go read that report. But if you're listening to this and you're a rep, you're a VP, I highly recommend you need to understand the market dynamics and investments, and more importantly, the money, where it's flowing and where it's going in our industry. This report gives it all, not just medtech, but also biotech, health tech, and so on. We're going to focus specifically on medtech. So, Jonathan, first thing I wanted to sort of ask you about, because when you look at that report, it's divided out into different areas. How do you think about medtech as a sector versus, let's say, other sectors?
I mean, so we've been doing the report, at another organization before I joined HSBC a year ago. I sort of think about medtech actually as sort of the steady eddy of all the healthcare sectors. When you compare it to biopharma, diagnostics tools, health tech, they each have their own individual idiosyncrasies, right? And I think from medtech, for me, it's resilience more than anything. And I think, the medtech veterans out there can understand that, despite seeing, some amazing exits over time in medtech, it is really not unusual at all to see along the way either a flat or a down round or a tough financing, because these companies take a while to get to an exit. And I think that sort of resilience puts it in a really good spot in the ecosystem for sort of coming out of a really tough time. But so that's kind of how I think about medtech. So biopharma, you get a lot more IPOs, you have a lot more requirers. So the exit environment's a little bit more robust, but because of that, you also get much more frothy valuations. And so when you're in the good times, the valuations are extremely frothy. And when they're in bad times, you really have to think about, major valuation resets, et cetera. And you just don't get that as much in medtech. I would say biopharma and health tech are probably the two other sectors that probably had the highest sort of frothiness in terms of valuations in the 2021, early 2022 timeframe. But medtech kind of stayed steady eddy. And so I think from that perspective, medtech is different than both of those two sectors. And I think, when you think about the majority of companies that get started on the medtech sector, they typically are folks who, have a lot of experience in the sector. And I think that's where the difference is versus health tech. Health tech, you have this convergence of technology and healthcare, which you are seeing in the med device sector as well. But what you end up having is you have a lot of companies that end up getting formed with folks who have great technical expertise, but don't understand, maybe the healthcare and the sales process of selling into healthcare. And that could be a lot more difficult. Yet you have these tech investors that are used to having pretty quick jump from product into revenue and associating high valuations with that. So that's been one of the biggest issues that we saw outside of medtech, but medtech is steady eddy. And that's kind of how I think about them in the ecosystem.
When you look at your report, and I'm looking at it right now, some of the activity that you showed, like for example, on the first financing analysis, your activity showed that compared to previous years, and we're comparing 2023 to 2022, compared to 2022, our annualized 2023 investments were down 18% compared to 2022. Compared to 21, they're down 40%. That's kind of understandable. 2021 is kind of a wild year post-COVID, so I almost don't count that year. But overall, it's down 18%. Is that a concern for you?
Not. I think The most interesting thing, I think, again, on the MedTech side, MedTech had the lowest or the smallest percentage decrease versus 2021 than all the other sectors. Again, I think maybe it's a little bit more in the first financing than if you look at overall within MedTech. But I think that what it comes down to is, yes, 2021 was an aberration. And you almost sort of throw that out because any record that could have been attained in terms of number of deals or dollars deployed or even, M&A, IPO opportunities that were all like maxed out as record numbers as a part of 2021. So when I do think of 2021, yeah, you sort of put it outside of sort of your comparative analysis. But you go back to 2020, you go back to 2019, MedTech numbers are really strong. So yes, is it down from 2022? Yes. Is there a reason behind that? Yes. I think the biggest reason is, the current environment we're in has been a lot of insider round versus new investor led rounds. And when you actually do that analysis, it's about 50-50 in terms of split. If you look at all the financings that happened that weren't sort of the first financing, they were post first financing, half of those deals were add-on or insider rounds, which means, somehow these folks are not hitting the valuation inflection event that allows them to find a new investor coming in. And so those rounds typically are smaller. And so having that decrease from 2022 doesn't really surprise me. And the fact that it's not so substantial makes me feel like even in a time where half these deals are insider rounds, and you can just read that as smaller rounds than they would have raised if they had a new lead coming in to lead a round, it's still like, I feel like Med Devices is still in a pretty decent shape. And so, where are we right now? We're dealing with, 2023 where, all these insider rounds happened. And what that means is that those companies are going to have to come back out to the market somewhere between 6 and 12 months for when they raise their inside round to raise a new round. And the insiders are probably not likely to be supportive and do another big insider round. They want these companies to find a new lead, right? And so that's where the rubber is going to hit the road in device. And so seeing all these insider rounds, it's cause for concern. But if you just read those as smaller deals than what normally would have happened, you can understand why you saw that decrease from 2022. And so when you all put that into context, yes, it's going to be a tougher time into 2024 when these deals are going to have to figure out a way of raising. But I do feel like, we're in good shape. And I have some, data that I just crunched for Q1. And I think that is pretty interesting because, what we're seeing is stability on overall investment in MedTech. And you're actually seeing much higher percentage of new insider-led rounds in the first quarter of 2024 than you saw all of 2023. And so
really? Why do you think that is? Do you think it's because people didn't deploy capital that much in 2023 and now they're just emptying out their I don't know what the analogy would be. They're emptying out the rounds. I got to stop using the gun analogies, but I think you get the point.
I think there's a couple things happening there. One, the folks that actually had these milestones moved and raised insider rounds, they either achieved that milestone or they didn't. And so it is time for them to go out and raise that next financing. I do feel like that the overall, I would say the venture downturn sort of bottomed out towards the end of 2023. And I feel like investors now feel like they understand the valuation environment that they're in. They understand the exit environment they're in. So they're more willing to go out and deploy capital. I think while the knife was falling down, how do you catch that? And, what's the right valuation to come into a new deal, even if they really like it, was a struggle. And you pair that with all the other, you think about a venture fund themselves, all the other portfolio companies they were dealing with at the same time. They got to figure out which company is going to do an inside round, which company is, just that the dog's not eating the dog food and we got to figure out some sort of consolidation, or, are these companies going to be able to raise with a new lead coming in? All those discussion parts, that was really like Q4 2022 into the full year 2023. And now we're sort of coming out of that. And so I think the idea of these valuations coming to a head where people understand what's going on in the market, I think that's very a good place, especially in medtech. Even in you saw the largest deals in Q1 in medtech. There were a couple $100 million deals. I think there were 8 deals that were actually I think I was 10 deals over $50 million in Q1, and of those, I had 6 that actually had valuation where you could actually do a valuation calculation. Like, was this a step up? Was it a step down? Was it a flat round? 3 of them were step ups. 3 of them were flat rounds, no down rounds. I just think that's really an interesting perspective to also go in and say, okay, everyone kind of understands where valuations are. The fact that these folks are either up rounds or flat rounds means that these are really exceptional companies that are coming back out to the market. Because, I think it's fair to say, flat to slightly down is the new up for the bottom 50% of companies that are out there. But the very top edge of the companies, they'll find ways to get to, a step up, right? They're always going to be folks in the top 10% of companies that are going to be able to secure multiple term sheets, et cetera. So I think there's a lot of positive momentum on one side of the ball, but on the other side, you have this, let's say your back end, your bottom 40% of companies that are on inside rounds that are going to have to figure out if they can get a new investor to come in. And the investor side is also a really interesting part of the equation, because it's not just deploy your capital, go raise your next fund. It's what's my fund look like? How much distributions have I gotten back to my fund? How my LPs are going to look at that and say, yes, you're in a position where I want to re-up and invest in you so you can raise your next venture fund. There's a lot of mechanical parts to that, including distributions and including the step ups that you had in 2021 that are now going to become step downs with your new financings. So the carrying cost of these companies are going to get impacted pretty negatively. And so all these investors, they have a certain amount of new capital ready to invest into new companies, but they're trying to be smart about that. Because as soon as you make, your second to last or last investment into a new company as a fund, you're going to be looked at as, aren't you in the fundraising process for your next fund? And if not, why? And so it's a very tricky sort of time. So to see actually, good amount of investment in medtech in Q1 makes me feel like, we're on a little bit the other side of that. But that being said, when you look at the exit environment, it's not like it's a wide open IPO market, or you were seeing, M&A left and right. It's steady, but it's not great. So I think that's one of the biggest challenges that we're going to see in the market is, if you have, traditional venture investors, how many of those folks are going to be able to raise their next fund? And I think we have a bunch that did that in 2021 and early 2022. But what's that going to look like for the next fund after that?
Got it. It makes a lot of sense. And I guess, for me, I feel a lot more hopeful. I mean, towards the end of last year, we had the Exonics acquisition by Boston Scientific. This year, we kicked things off with a bang. Shout out to Daniel Hawkins and team, who saw that $13.1 billion exit of Shockwave to J&J. So it's great to see. Do you, based on what you just shared and some of the things that we're seeing in the market, do you see sort of an uptick in the medtech industry then this year compared to last?
I think if it was steady, I would feel good about it. And that's just trying to be realistic based on where the macroeconomic environment is. And I certainly am not a politically astute person, but just like everyone else, there's an election coming up.
And being in war, we have multiple wars going on. We got inflation. There's all these things that are just going against us right now. And I feel like at some point the pendulum has to swing the other way so we can get back to the good old times,
Yeah. So treading water, I think, would be a win on the medtech side. I think the one thing I worry about on the medtech side is early stage. Really. I mean, I think if there's one issue that I sort of, you can always talk about, I wish there were more acquirers out there. I wish the deal sizes were bigger. And actually last year they were actually pretty good. But early stage is the area I fear most.
And when you say early stage, are we talking about mainly seed stage companies, series A, B, how early stage are we talking?
Yeah, I think we're talking really sort of first institutional investment. And I think the issue that we're finding is that it's really hard to, one, put together a syndicate, and then two, especially if you have a PMA pathway company, which typically you do if you're like cardiovascular or neuro and sometimes orthopedics, et cetera. If you have an impending pivotal trial that you're going to have to raise money for down the road, it's really hard to find a Series A group that's willing to put that money out the door to get that initial product underway, because nobody wants to come in for Series B. Because Series B is not pivotal trial funding, it's early clinical development. And it's like, well, what, why would I come in at that point? Why wouldn't I just want to wait till you get your pivotal clinical trial ready to go, and then I'll help fund that? I don't want that stuff before. And so what you end up having is the Series A investors almost have to do Series B on their own, because they can't find investors that are willing to step in at that point in time. So it's a huge risk, because these firms have to deploy a lot of capital before they get to the pivotal trial funding time. And so, so 510K is a little bit easier, because you don't have as much clinical development part to it, and you can get to commercialization pretty quick. But the PMA side, you're really seeing, especially in cardiovascular and neuro, when I look at first financing, data, that's really wanting. You see the later stage on cardiovascular and neuro pivotal funding into commercialization. You're seeing a lot of players on the traditional venture side as well as the growth side stepping up to lead those deals. But early stage, really hard. I feel like I can count on one hand sort of the really dedicated early stage investors that want to invest in those deals.
Yeah, and for the audience who are listening who are not familiar, PMA stands for pre-market approval. And one of the things about that, and correct me if I'm wrong about this, Jonathan, is that essentially this is for class 3 medical devices, and mainly because those are the ones like, so cardiovascular side is a good example. They essentially support or sustain human life. So because of that and the risk associated with that, the FDA is saying that you got to go through a PMA, which simply put, it's harder to get to market, and the regulatory pathway is so much harder. It's almost like a biotech investment at that point. And so getting that funding early on is, it's a lot of money, and it's just a lot, and the risk is huge, because it could be that you don't get through,
Yeah. I think you're thinking about it the right way. I kind of think about it. I'm not a science background person, so I sort of think about PMA typically a novel way of doing something for a big market. And because there's no already existing product out there, you got to prove to the FDA that this thing is working the way you intend it to work.
What's a good example of that, I was going to say, for our audience is Neuralink. Neuralink's a great example of that, because again, that's, we're talking about brain computer interface. For those who for some reason don't know Neuralink, that's the Elon Musk company, but it's being implanted into the brain. And so there's just so many precautions and risks that's involved with that. But I'm wondering, so if you look at, Jonathan, the biotech area, the biotech area really relies on M&A. Prometheus is a great example, who got acquired by Merck, I think for 12 or 13 billion. They needed that to happen, because to get to the next levels and phases of their trial, you need a lot of money, maybe even $1 billion. On the flip side, for MedTech, for PMA, do you feel like this is an area where we really have to rely on the strategics out there who are going to say, we have the ability to take on that kind of risk and fund these kind of companies early on? Because I don't see any other avenue. I don't see family offices being able to do this.
I think you're right. You'll always have the growth investors that are around there, but I do think, that's one thing that we've seen a lot more in biotech than we have in medtech, and that's sort of corporate support, both corporate venture and just strategic investment. It feels like you see a lot more of that happening in biotech than in device. And I think you're right. We really need to have that. Now, certainly, the device big acquirers have, a lot of them, most of them have venture arms, and they're active, but we need them to be even more active than they are now. It needs to be, it has to be almost a collaboration. And that's what we saw in biotech. If you go back in 2013 or so, you saw all the research folks in biopharma basically got cut. So you have R&D, so you have research and development, right? All the research people got cut. And at that point, they started to invest directly into venture-backed companies to be their R. And then once it got to a certain stage, they would pick it up and bring it in. I feel like we don't see that as much in device. You do see some build to buy, and that certainly is a term that you hear out in the market, and maybe we're seeing a little bit more than we've seen in the past. But to see that more of the collaboration with the strategics, I'd love to see that more because it's so critically important. I think the one thing to also remember is, you know, you got to be careful as a med tech that's a PMA focused company around how much capital do you want to put into your company? Do you want to commercialize and ramp up and think about an IPO, or do you want to make sure like you minimize capital in and think about an M&A? And it's really there's not an easy answer to that. I think what happened in 2022 was there are a lot of companies that thought IPOs were still a hot area on the medtech side. And they raised mezzanine rounds to, instead of entertaining an offer to get acquired before approval, which happens quite a bit on the PMA side, not on the 510K side. Those usually have to raise a commercialization round and ramp. But on the PMA side, we see a lot of companies that get to an exit in the middle of their pivotal trial or after their pivotal trial is over, because big guys see the progress of that company and that product. They see it works, and then they just pick it up. Yeah. But if you raise the commercialization round, then you're taking yourself outside of the value of where an M&A typically is, because you're probably valued at now $400 or $500 million post money if you raise like this big $75 to $150 million commercialization round, and you put yourself in a really tough scenario, because then you have to really you become a commercial company, and everyone sort of thinks about acquiring you as a multiple of revenue versus being an early stage development stage company in a pivotal trial, and you have an enterprise value that's part of you that you don't have to have hired a big commercialization crew and get to work on sales and building your sales year over year. You want to get acquired and just put your product right into the hands of a big acquirer that already has that commercialization group set up.
Yeah, and I think it's a great point to make a note of that. I mean, a lot of the companies that I work with and I'm familiar with are 510K, in which case they need that commercialization ramp. In the past, even 10 years ago, I think a lot of companies didn't think of it like this, which is, if you have good patents, you have a good product, et cetera, then you can get acquired. These days, I feel like part of your valuation is to be able to actually show your CRM and say, hey, like, here are the deals, active deals we got going on. Here are the KOLs that we have. Like, in some ways, the acquirer is not only just looking for a great product, but also a great commercial product that they can buy ready to go. And so it's almost like, I think in the past, and you let me know what you think about this, Jonathan, is that in the past, it was very much focused on build to buy, right? And that's all you got to do. Now it's almost kind of like you got to build as if like you're going to go it alone. And if you do that, you've built a great company that someone's going to want to acquire, not just for the technology, but also the product, the people, the commercial processes. I wonder what your thoughts are on that.
Yeah, I put it into two different buckets, like you were mentioning. Like on the 510K side, it's been pretty apparent through the years that those companies have to get into commercialization. They have to, and this is the unfortunate part of the good and bad of the 510K side. The good is that you can get into commercialization fairly quickly because you have like a predicate device that's out there that you're using to get clearance to go out into the market. The tough part is that you have to build your own sales force, take a whole sales plan that the big guys already know everything about what there is to sell, probably your product in the market that they're interested in. Yet they want to see sales, growth, right? They want you to get as close to being accretive as possible before they pick you up. And it's almost like, it's sad because, these companies have to spend so much money on salespeople and building the market, et cetera, for them to get to an exit. And it's just, it's almost like it's superfluous spend in a sense, because once you get acquired, that just kind of gets put into the toolkit of the big acquirer, and they already have those sales folks all set up. So I think, that is true. I do think, on the PMA side, as I mentioned before, like you still have that toggle because, you can decide that you know, it, depending on where the IPO market is, you just have to be careful about, how much capital that you're raising, right? And if you decide to go big and try and become a standalone company and go public, you have that danger of the window closing. But on the other hand, we were mentioning before when we were chatting, look at Shockwave. Shockwave decided to go big, to build it out, become a standalone company, get into the public marketplace, grow and be very successful, and then look what happened. So you have that opportunity, but unfortunately, you don't have control over the financing markets being open or closed. And so that timing thing is the rub. And so I think that's where, unfortunately, you're going to see, a number of M&A in device in this coming year, where you're going to look at the dollar amount exit and say, oh, that's a pretty good exit. But then if you go and look up the financing of these companies, you're going to see that, it's not much, it's probably less than a 2x, right? They did raise mezzanine financing thinking they were going to go public. And now that's just a really difficult pathway to be on, right? We certainly haven't seen much happening this year on the IPO side.
Yeah, absolutely. And looking at your report, one of the things that you showed in terms of just funding, like in terms of the largest deals in med device, just for the audience. And by the way, I'm fanboying right now, but like it's such a great report, mainly because the information's good, but also the visuals. So the largest deals that you had in med device in 2023, in this order, we had Neuralink at 323 million, CMR Surgical at 165, Distal Motion at 153 million. Those two that I just mentioned to the audience, those are surgical robotics, right? And then there's a few others. The main thing that you pointed out was that neuro and imaging saw a big jump in investments. Do you see that trend translating into this year? What are you thinking?
Yeah, I do. I mean, I think neuro is a hot area that's sort of here to stay. Both brain computer interface, but really sort of neuromodulation, neurostim. I think, the ability to get into areas where they haven't been before and affect different things. And again, I'm not a science person. I just look at the deals and try and understand what they're doing. I think neuro is a super interesting area that's going to continue to get big investment. And really, it's a trend of continuing because they saw a lot of early stage investment over the last few years. And those folks are now ready to raise pivotal trial funding. And I think you're going to find a good opportunity to put dollars to work there. On the imaging side, I think that's also a super hot area. And when I think about imaging for device, there's a difference between imaging that's just SaaS based and they don't have a piece of equipment. I put that in health tech. But if it has a piece of equipment, then I put it in device. But it's really it's device plus AI and cloud-based SaaS services. I think those areas are super interesting because I think you can see how the technology has improved the practice of medicine, and I think that there's a lot of interest there. So I think both of those areas will continue to be really hot. The one area that I think continues to see a little bit of a fall is the non-invasive monitoring area. We saw a couple good exits like in the 2021 timeframe, and that begot like a lot of companies raising $100 million plus rounds. And sort of non-invasive monitoring, in terms of how I think about it, is just basically sensor-based technology, typically for use outside the hospital, that just allows you to monitor different things. It could be cardiovascular, could be vitals, et cetera, and just finding a way of keeping the doctor and up to date as to what's happening with their patient outside the hospital. I think that's a really intriguing area. We just haven't seen a lot of exits since 2021 in this area. And I think we're seeing major valuation resets in this arena because everyone got hot once I think it was like Barty DX, and I'm trying to remember, Preventus, I think, was another one. And there were some really nice big exits there, and valuations got a little bit frothy, even in the medtech side. So I think there's a little bit of a coming back, a culling, and you're just not seeing as many early stage non-invasive monitoring companies because it feels like, there's some other bigger players out there that have gotten the majority of the funding. And I think, those are the ones that seem to be the only ones that are gathering capital these days. So it's an interesting area to see. So non-invasive monitoring, not as much activity, but definitely imaging, definitely neuro. Cardiovascular remains, a very strong area because you just get great acquirer interest there. But it's funny, like, if you don't see early stage deals getting done now, like, what does that mean for 2 to 3 years down the road for finding late stage cardiovascular deals, right? If they don't get their first round of funding, they never get off the ground. So it is a little bit of cause for concern, but you're still seeing the later stage cardiovascular deals that are raising for pivotal trial or raising for commercialization. There's lots of interest there.
Yeah, and it's interesting you mentioned the non-invasive monitoring. I feel like, the two issues that they have there, one is like essentially compliance and efficacy by the patient, because if it's not invasive, the patient can like not wear that monitor, right? That's number one. And two, since it's not invasive, you can't bill as much. I'm hoping that changes just because it seems that more physicians are getting interested in telehealth because, I mean, it's reimbursed really well, it's scalable, etc. And so maybe we'll see a jump back on that. The invasive monitoring seems to be pretty interesting. And I see more companies coming, at least through LSI on that side. Have you seen the same thing on your end?
Yeah, and I think monitoring is a huge part of keeping your patient as healthy as possible and preventing that rehospitalization, right? So I think there's no doubt that it's important, but I do the idea that you can now monitor so many things in a patient consistently is a huge sort of game changer for overall patient health. But I think you're right on the who pays for it, especially on the non-invasive monitoring side. And you also have this mix of how well does the med device community really understand that pathway and that technology. That's where you have a little bit of a gap as well. And I think, one of the reasons why the valuations were so frothy for the companies in 2021 and early 2022 is those were mostly led by more of the tech investors who understand the technology and wanted to apply it in healthcare. And maybe now they're running up against, some of the harder facts of really trying to make a commercial success of devices in the medical field, right?
I completely agree. And I think, that's the big thing, which is, for these non-invasive, I think there's a huge opportunity there, but it's almost like you have to get the expertise of tech where they can drive B2C adoption at scale, which means you need like master marketing strategies in place, digital and everything. I mean, look, I'm wearing a Whoop device, right? I mean, they spend a lot of money on acquiring me as a customer, and you need to know how to do that. Otherwise, you waste a lot of money. But on the med device side, is having a team that actually knows the regulatory pathway and, more importantly, how to drive B2B adoption with healthcare systems and doctors. And I feel like it's really hard to do,
Yeah, and you really, in the perfect world, you have a combo of both on the board, and you have a direction that makes sense. But when you don't, and then you have maybe a team that's more technology focused and healthcare focused, you don't know what you don't know, and it can be a real struggle.
Absolutely. Jonathan, I know you got to run in a moment, and I really appreciate you coming on the show. And like I said, look, my audience is going to love you. They know about your report. Again, for those who are listening, click the show notes below, download the report, read it. It is a fantastic report. I guarantee you're going to love it. And Jonathan's going to come back because he told me that he'll come back on the show. But last thing I wanted to ask you, predictions for 2024. Like, for example, correct me if I'm wrong, I think the last MedTech IPO we saw was back in like 2021. I think it was either Procept or one of those companies. Do you have any predictions for 2024? IPO predictions, anything? Give us something.
Yeah. So I think what I saw that was interesting was, the M&A side actually for private last year had the biggest upfront median and total deal value than we've seen in like 3 or 4 or 5 years. So I think that's good. Although the pace was down, the deal sizes were good. And I think that we're definitely going to see some bigger deals happen. I struggle to think that the IPO window is going to open this year. It just, even if we have like a really good first half to the year, I think, again, you have all these other macroeconomic things, and even IPOs in biopharma, which is the easiest group to IPO, like they have IPOs, but it is a one-off event. Like, I think there's probably maybe 12 IPOs so far this year. And I think, they're lucky to have those. I don't really see an IPO market opening up this year, but I do think that there's a really strong crop of companies that are in revenue growth that were funded in 2022 and into 2023 that are going to be really good spots to think about an acquisition. I don't
Feel
love,
free to drop any names.
yeah, well, I don't, I love the fact that, you started to see some mid-cap folks being acquisitive out there, but then you see, Shockwave, which is an amazing result for the company and a great opportunity. But then what does that mean for, acquirers? And, how long does it take to digest that? What does that mean? Does that take an acquirer out of the market? It's good and bad. But I do feel like we're going to see a very steady, again, year for med device. If Q1 is any sort of, important for what's going to happen the rest of the year, it feels like it's going to be steady. You're going to finally see these companies either raise a new round or not. And it's going to be a tale of two cities. And it's like, there's going to be a lot of companies that raise new rounds this year. So there's going to be a lot of companies that are forced to consolidate. And that's a really sort of sad sort of event. And that's what happens when you have a really frothy top of the market, is that, things get overfunded and then there's not enough funding to continue to support all the companies, even if they've done everything that they promised to do. The milestones of what enables a new financing, it's whatever a new investor says it is, right? Even if you hit every single milestone that you've laid out. So it's a little bit of good and bad, but if there's any sector in healthcare that can survive and sort of thrive in 2024, it's medtech, because, it's battle tested, it's bruised, it comes out the other side, and, it just keeps going, right?
I agree.
In 2009, people could they almost thought that it was, medtech was gone, because there was nobody investing and no private capital out there, no IPOs, and it always came back. So I hold out hope that, of all the sectors out there, medtech holds a special place in my heart. I really love the people that are involved. The networks here are just amazing, and that goes a long way to helping survive in tougher times too.
No, I completely agree with you. Jonathan, thank you so much for joining us on the show. I'm looking forward to have you back as a repeat guest. For those who are watching, again, click the show notes below, download the HSBC report, go give Jonathan a follow on LinkedIn. I'm your host, Omar M. Khateeb. This has been another episode of the State of MedTech. If you haven't already, subscribe, give us those 5 stars, and write a review. We're the #1 show for a reason, and we'll see you all next time. Thanks for checking out this episode. If you want to do me a big favor and join so many other people who have helped grow this podcast, take a second and look below. If you're on Apple, give us 5 stars and write a short review. If you're on Spotify, just give us 5 stars. And if you're on YouTube, hit the like button. And most importantly, if you can, subscribe. We release so many different episodes that you may miss. Be sure to subscribe and turn your notifications on. You get extra points with me if you subscribe across all 3 channels. Thank you so much. And if you felt like this episode helped you, send this to somebody who'd really enjoy and appreciate it. Share and spread the love. We'll see you all next time.